We are going to get started. I know people are still joining, but this way we have plenty of time for questions and for our presenters to go through their presentation. So really quick, if you do have any questions throughout this presentation, please use the QA function down at the bottom of your screen. Closed captions are available if you need them. If you have any comments, you can also put those down in the QA. We'll have those available for everyone to see. We have two presenters today for this session. We have Russell Opatz. Russell is the Supportive Housing and Services Director for Housing Connect. Russell has been with Housing Connect since 2013 and is currently serving as the Supportive Housing and Services Director. Russell's over 10 years of experience in human services with an expertise in designing and implementing equitable and inclusive service delivery models that support individuals and families in maintaining stable housing while increasing self-sufficiency. Russell graduated from Warren Wilson College in Asheville, North Carolina, with a degree in outdoor leadership. Our second host today is Zach Bell. Zach serves as the Chief Program Officer of Housing Connect and the Executive Director of Housing Connect Fund. He is a member of the Salt Lake Valley Coalition to End Homelessness Steering Committee and co-chairs its Housing Core Function Group. Zach is a licensed clinical social worker with 20 years of experience in affordable housing, human services, fundraising, and leadership development. He holds his master's in business administration and master's in social work from the University of Utah. Zach, if you want to, or Zach or Russell, if you want to get us started, we'll be good to go.
Let's do it. Yeah, thank you all for coming today. I'll just kick off and then Russell, you're gonna lead us out. So just really excited to share this with you all. I would suspect that for some, this concept of social determinants of health will may not be new to you. For others, it may be new, and for maybe some other folks, this will be kind of a new way of naming something that maybe you've known for some time in your work. So we look forward to it. And yeah, Russell, you want to lead out?
Yeah, great, thanks. Yeah, and kind of like Zach said, I hope and I think that most of you, as we go through the first portion of this presentation, just kind of doing a general overview of what social determinants of health are and the framework. If you're not familiar, I think, as Zach mentioned, you will immediately be able to resonate and relate the model to the work that you do. So try not to spend a lot of time on getting into the weeds of social determinants of health, kind of a high level overview to begin, and then get into some other areas of how we at Housing Connect have implemented the model. And then Zach will kind of end with a discussion on how this relates to local impact and ending homelessness. And hopefully we'll have a rich discussion there on kind of community level activities. So just to begin, very simply put, as the CDC puts it, the SDoH model are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. So pretty broad, right? It really captures, I think, all of what we do as people in all aspects of our lives, and really pointed out that each one of those categories plays an important role in our overall health outcomes and life expectancy. And to the next slide, it's not what some often think and systems often think of mainly related to medical care, right? So medical care alone will not determine an individual's life account for a majority of an individual's life expectancy. So as you can see here, 20% is about all that healthcare accounts for. So that's direct care and access to care for healthcare. And then the other 80%, as you can see, are broken out into various factors. So socioeconomic factors, education, job status, social support, income, physical environment. So that would include housing, where one lives, access to resources nearby, walkability, components like that. Health behaviors, so behavioral components such as tobacco use, diet, exercise, substance use. So as you can see here, it's not all medical. And I think most of us know that. And the work we do really calls that out, especially when we look at, housing case management, homelessness services, all of those positions and work really focus on a lot of the other 80%, right? Obviously those, that work works to connect folks to resources like healthcare and access to care, but also tons of the work is just on that other 80%, right? Connecting to resources and making sure that folks are making healthy choices. So some examples of social determinants: safe housing, transportation, neighborhoods one lives in, racism, discrimination, violence, education, job opportunities, income, access to healthy foods, physical activity opportunities, polluted air, water, language, literacy skills. So all of these would be things that would impact social determinants of health. So if you are not familiar, or even if you are, if you just Google social determinants of health, there will be hundreds of models that will come up. If you do a Google image or if you just search on the internet, and it's really picked up steam and momentum in the healthcare space as a model that healthcare providers and systems are looking at for the reasons mentioned in that graph of the 20%. Healthcare providers are really understanding more of the population health and community health aspect of, they only make a small impact in a person's overall health. So how can they help impact that other 80%? And a lot of that is through work you all do with cross-sector collaboration. So a lot of these models are healthcare focused, but many are also community focused. I know we have many locally. I know Promise Salt Lake, I believe United Way, Unite Us, which many on this call are probably familiar with, is a national organization very much focused on the social determinants of health model and coordinating the referral process between agencies and at a community level. So there's one, not duplication of service, but also access to services as they relate to social determinants of health. So yeah, we could go a lot into that. It's in a lot of different spaces and there's a lot of different models, but they all generally look the same and kind of have the same categories. They fluctuate between 4 and 6 different priority areas. So as you can see here, really the key ones are going to be kind of the education, healthcare, environment or housing, social community context, economic stability. Many include food. So you see the food quality and stability on one of those. Some more, again, just very similar. The one on the right shows a little bit more detail on what each of those categories could include. And then some do a little bit more kind of a flow with the graphics. So a quick example, again, probably nothing new to this group. Yeah, so if people don't have access to grocery stores or healthy foods nearby where they live, likely going to raise their risk of health conditions like heart disease, diabetes, and obesity, and could lower life expectancy. So just really basic examples, I think, and hope that this model is really just putting the model, the framework to the work that we already do, right? A name to the work we are in. And as mentioned, I think in order for this to really work well, groups like Unite Us and others have really focused on that cross-sector collaboration. We really need to work across sectors in order to make impact. Using the healthcare example, it's exactly what they're doing, right? They're realizing that they have control over that 20% of direct care, and they spend billions every year making impact in that area. But there's opportunity for greater impact beyond direct medical care. So that's why they've begun the efforts with cross-sector collaboration and trying to coordinate into the other areas of population health. Real quick case study. This is medical based, but So a lot of medical organizations are using the SDoH model, and this is just kind of an example of, what they would maybe use for some of their practitioners to think outside of the medical box when working with a patient. So real quick, 71-year-old man has hypertension, knee arthritis, wife passed away 35 years, or of 35 years, passed away last year. Shops once a week. Other than that, doesn't do anything, doesn't exercise, doesn't smoke, drinks a few drinks a week, no history of depression, and denies feeling sad. So then the question to the clinician would be, which risk factors have been shown to more strongly associate with mortality than hypertension? I don't know if people want to throw in the chat what they think would be more strongly associated with mortality than hypertension.
Yeah, and I think the chat function's off. I think some put it in the Q&A, but
Okay, yeah.
if not, kind of think in mind, hold it in your head as Russell kind of walks us through it.
Yeah, it looks like someone, social isolation. That's what is more strongly associated with mortality than hypertension. So again, thinking outside of the box there. And that's a lot of the work we do, right? Is connecting folks to social activities and making sure that folks aren't isolated. And maybe some of the shared housing stuff that was in the session earlier gets at that. Yeah, Zach, do you want to take this one?
Yeah, sure. So we want to share a couple of kind of concrete things that we're working on as we've adopted it. And it's kind of Russell shared what's this model? Why grab a model and do things, and why is this important? Well, we know our work's not in isolation, and I think us as an agency, Housing Connect, sits with probably the question many of our, really any of the places we work, what's our work, what's not our work, where are we trying to make impact, what impact are we trying to make, and of what we're trying to accomplish as our goal, what levers do we pull, right? And so the example around the healthcare system, use Intermountain as an example, some of their intent there is to really help folks live the healthiest lives possible. But if in fact the reality is medical intervention is only 20%, it makes sense that they're coming attuned with, gosh, all of these other factors actually have a far greater impact. We have to think about what is that kind of some of the pond we need to swim in. So on our side, for those of us that are, if you're familiar with us, we do both housing and services. And there's been questions on what parts and what work do we get in. And with this role of supportive housing, we've known that, the foundation here in this picture number 4 is so critical of the homes we live in. But we know there's more, and that's why we've been engaged as an agency in supportive services and have had a lot of rich discussion internally about what's our work, what's not our work, who should we collaborate with. When we looked at this, it came out of us doing strategic planning and saying it actually brought up more questions than clarity at first. But when we did a summary of all the activities we do and we distilled them down, and we came up with a list of 6. And when we looked at it, it was this. The social determinants of health that came out of, kind of originated out of the healthcare field. So we landed there and said, gosh, how could a framework be helpful? Well, one, it might align us, both as an agency, and I think here presenting with you all as a community, to think about what are the core areas we're trying to seek to impact. And then what are the interventions that help make impact? So let's walk through the 6. So yeah, Russell, if you want to jump to the next. So our first was education, and here in particular, access. So something that's very clear, we probably won't run a school. That's not our area to do, but we knew there was something that's important here. Education shows a really strong connection with income as one connection. That relates a whole bunch to folks being able to afford housing. But there's also so much goodness that comes of growing and learning as an individual. So emphasis here on access. We have, similar to a healthcare system, a pool of a captive audience, and we have some commitment around that. And so this one very specifically is making sure that connections are made, connections with Head Start, connections with schools. As households move into our community apartment units, how can we be the best concierge possible? Something we all wish would. When we move into a neighborhood, what are the tips and the tricks and things one would want to know? Here's who you contact, here's where the bus stop is. So there's a couple concrete examples that we're working on. The second, next. So food, this one really arose much significantly around COVID. We saw that many households, one of the first things that was a struggle was having adequate money as you know, the economy fell out and jobs were lost, having enough money to have enough food. And so as an agency leaning in, and we really saw this as alignment. There's a lot of great groups and partners that join us in the community to help ensure this is the case. And one of the roles we saw is we are engaged with our folks. We at times are invited in and be in their unit, and we can see how things currently are. And to have this on our radar, not just really all our staff that are involved, to know that food is important. If we think just maybe linking to the education example, kids sitting with hungry bellies aren't quite in the state of mind to learn. And schools have known that for a long time. And fortunately, there's been great work to ensure that hunger is met so that then education can happen. So there's a touch on that one. Community connection, gosh, could not be better fit for our first case scenario. So when I looked at that originally, I didn't jump to social isolation completely. I thought, gosh, medical, and there's a couple of references to some things that might be going on with that individual and his kind of biology. But gosh, we know this is true. And if we think most directly to the work we do around housing and homelessness, I think probably one of the strongest correlations of folks not entering homelessness is a strong community connection. That's one of our last safety nets. And we know that many folks that fall into and experience homelessness, there's really a need to have greater connection with friends, family, and other supports. And we do work in that area. So we know that's important. And then for broad, healthy communities, this is just critical. This is the glue that makes where we live worth living in. This one should come as no surprise that our agency identified this one, housing stability. So we are actively in the work of increasing how many housing options are available through subsidy and developing units. But as an agency for so long, we've worked towards, it's not just arriving at moving into a unit and making it home, but making sure that folks have access and stability long-term in housing. So this one was a very easy one to land on. Financial health could not be more tied to the work we do. And there's a lot of kind of thoughts around this edge, right? You know, in the work and kind of how maybe there's some perception around folks who need help, or maybe you're experiencing homelessness and that thought of like, gosh, you got to go get a job. And but the realities here is if we are in a strong financial position, and that could be including receiving housing subsidy, receiving assistance from the state, that makes things way better. We can both afford rent, we can afford the medication if we have medical needs, and we can afford to do things that we probably each do to help make life feel great, like if there's an upcoming holiday. And so we've known this is important, and eyes on this have been the case for many years, both earned and unearned income. So health access, again, emphasis here on access. We've had longstanding partnerships with 4th Street Clinic, working with each of the medical systems, knowing information about insurance, and we've known this is a critical element. And so this one was very much on our list. And we see as us as an agency, and this would be different for each, but what's our role around health? And ours is to make sure that that connection is there, spanning anywhere from insurance to transportation barriers to helping support kind of a continued connection with the provider.
Great, thanks, Zach. So hopefully that provided a good either refresher or overview for those who were not familiar with the model. Now we'll kind of transition into how the SDoH model relates to the work that we all do, and specifically starting with housing services. So as we all know, case management is one of the main services provided in the efforts to end homelessness, and in a lot of the work that we all do, for sure, in housing resource centers kind of across the spectrum of homelessness. And to no surprise, the definition of case management includes many of the social determinants, right? So services that assist with gaining access to medical, behavioral health, housing, employment, social, educational, and other services. And again, I think one hope out of this session too is, as I know I can speak for myself and others within our agency, as we've kind of adopted this model and done more work in it, I think you just start to see SDoH called out in almost all the work we do, whether you're reading about a program in another state or federal grants, research. I mean, it's all like this example, right? Like they're not calling it out as social determinants of health, but you can very easily apply this framework to the work of housing case management and how it's defined in almost any definition you find. So again, just kind of putting a framework to the work that's being done already. And then next, kind of on the supportive housing piece, I think this has definitely been a topic at this conference in the past and many others. Kind of it's been said a lot as, you know, housing is healthcare. Again, you could probably say that for a lot of the determinants, depending on what agency you work for, right? All determinants are important, and each is a great foundation for success and healthy outcomes. But housing for sure is a foundation for health, and you know, housing with supportive services really provides that platform for improved health and stability. And again, through case management, just connecting folks to resources. The physical benefits of safe housing, you know, are listed here, which should be obvious, right? So physical safety, protection, access to basic needs, reduces individuals to harsh weather, illness, harassment, violence, secure place to sleep, store food, clothing, medication, and essential for promoting personal hygiene and recovering from illness. So kind of to the basic needs, right? And that's how we at Housing Connect, and to Zach's point, kind of why we adopted the model, and really, you know, as a housing agency, that's what we think is the foundation, right? But that's up for interpretation, and I think each agency could say the same for the work they do in the model. So again, just the importance of having supportive services, especially on-site and in scattered sites. So a lot of our PSH programs just providing access to care and a physical space for the service delivery that's needed, right? I think, I'm guessing many on this call are working or work for agencies that do work within the resource centers or maybe street outreach. It's really difficult to get folks access to the services they need when they're in an unsafe environment, whether that's the street, shelter. It's difficult, right? I think there's for sure the physical barriers of, is it possible to do it in this environment? And then there's, I think, the safety and emotional safety of the individual. Even if, you know, if you take a resource center or somewhere that's really nice and may have the space, maybe there's not physical safety in the individual to be willing to receive that service. So I think housing is key in that way. It provides that safety and space for the service delivery that's needed. And then really with the housing case management, that comes in kind of the next bullet of engaging with tenants and really working towards self-sufficiency and really them owning their own care and promoting lifestyle changes that lead to good health. And that's a lot of the work in the case management world, right? And then whoop, I'm not sure what just happened there. Sorry.
Mention an item while you're loading that up.
Yeah.
One thing we'll kind of weave through here is just thinking what Dr. Simbera said of kind of housing first and the supports. And one of the things, there's certainly a lot of questions about the model. How does it work? And it's kind of fallen in and out based upon kind of the zeitgeist of the federal government. It's not fallen fully out, but there's been some question around it. And one of the elements here is, yes, this is all connected and this all relates, right? You can't have one without the other. And there is some assertion, certainly with the housing first model, that something needs to come before maybe another thing, and hence aptly titled housing first. That might need to come to then be the foundation. So just a segue to maybe that point too that Russell was talking about. And this framework may also be helpful as we really advocate and support that model. We know it works. We've done it for years as a community, and we need more of it. So I know there's a lot of buy-in, but there's also certainly folks that have some question about it. So this might be one way, just to maybe an ask to the group here. This is another tool we have to kind of really provide context to folks that may say, well, shouldn't we do it a different way? You know, folks need treatment first, or housing, but why do we have to pay for all these other, expensive things that are attached to the housing? So, back to you.
Great. So you all should see the slide again, right? Good. Cool. We can do another quick example here. So 45-year-old man, type 2 diabetes, elevated blood sugars, hypertension, several elevated blood pressures in his daily log over the past weeks, is adherent to his medication, eating a lot of fast food, recent changes in finances, so inability to afford his monthly medications and fresh food, less income from landscaping work due to winter, so his utility bills have dramatically increased, and largely due to cost of heating his poorly insulated home. So I think a lot of us can relate to this. A lot of us could probably point to a community resource that would help here. If you want to throw in the chat, I'll give like a few seconds and then we can talk answers. But which of the following would help the patient improve medication adherence and access to healthier food?
If you want to share your answer, please feel free to put it in the Q&A.
Sorry, these are pretty wordy slides to have you all read. So the answer for this one would be C, so referral to weatherization assistance program to reduce energy bills, freeing up money for food and prescriptions. So again, this is a medical scenario, so it could be, either a home health agency, nurse practitioner, whoever, meeting with a patient, and they're not taking their meds because they can't afford it, and they're eating unhealthy food because that's what's available and cheapest. So in order for medical intervention to work, other areas need to be addressed, such as freeing up more income by accessing heat assistance, right? So again, working across sectors to, in this case, target medical intervention, right? So making change in one of the other social determinant areas to make direct impact in the healthcare category. So
Yeah, maybe to jump in here, what I see as I was thinking through those, Russell, and when we were connecting is it's like, how do we get curious about this stuff? And I think the social determinant framework helps us think about what else might be at play. And, in this case, each of these I could see, as we work with an individual, and this is also true on the macro level, as we have these global views about where to start with the work and what intervention would work. It's like, oh, it's behavioral. Clearly he needs some attention on, like, he just needs to hear more and do what he needs to do. And, like that school example as well. It's like, gosh, why is this kid not, sitting and focusing and like just being a good student? Well, maybe they're hungry, and in this case, it seems like this element around weatherization assistance, there's a structural piece here that, if changed, this actually could be a much more sustainable intervention, right? In terms of, well, gosh, if we fix that, then there's some agency around, well, I actually do have money, and some know-how and ability there to, seek out and obtain food and prescriptions. So then in certain cases, this might be a little bold to say, but we're not, maybe belittling or removing the agency of the individual to say, oh, you really need, yeah, you can't figure this out. We need to do it for you. Nope, we don't want to do that. Maybe on the one end of the spectrum, and also on the, on the other end. This occurred actually around food and COVID. So I made kind of a mental error briefly until we leaned in and listened to the folks that we house and serve. I was sitting thinking, gosh, if households receive assistance from us, housing assistance, like, isn't a big foundation of that, like, to make their financial situation well, right? And kind of had the thought of, like, well, gosh, if we help support their rent, then they'll have enough money for food. Well, a lot of our households didn't have enough money for food. So both the cost of housing, the cost of food, the cost of transportation, if we look at our demographic of households we serve, and I'm sure our number is quite a bit higher than many of the folks, even if we just look at the demographic of folks currently experiencing homelessness, average incomes are in the $13,000 range. And so even with supporting housing cost, stretching $13,000 for a year for all the other expenses is not a lot of money. And so when we think of system things in that ways, we start seeing more. We start seeing other interventions that are important and impactful.
Great, thanks. I think that's a good segue to development, and really specific to location. Location matters. Much of what Zach just said could be a symptom of location. If a household is getting even deep subsidy in rent assistance, they may be really far from public transportation. There may not be a grocery store nearby that sells healthy food. A school may be too far away, or they may not be on a bus route for school. Childcare. So all of those things, I mean, that's all cost, right? Like, those are dollar signs of to access all of those things. So it's barriers to access, and location does matter. And when we and others develop new properties, I think it's important to think about all of those aspects. And I know that, and I don't know who's in the room, but oftentimes on the developer side, it's really just, how do we make a property pencil with, the different layering of subsidy and financing. And there's a little bit on location, but much of that is driven by points awarded in various applications, right? Like with tax credits. So transit oriented, so being close to transportation, and that's great. And that would be more from a policy side, and there is more work being done within SDoH at that level, right? At a higher level of really driving some of those things home. So incentivizing developers to build in transit-oriented areas or areas of opportunity. So there is some of that, but I think also at least Housing Connect, we've adopted this framework and really wanted to use it to how we shape outside of those applications, how we choose not only a location for a property, but really what do we do to, what are the amenities that we add to a property if those things aren't naturally found in a location that we have. So using the framework, health outcomes for residents can often be predicted by the physical location and design of a project. We talked about that. And then, so Housing Connect we've designed a tool to be used in the pre-development stage alongside the project feasibility studies that evaluate future success of projects using the SDoH performance indicators. So we're taking the 6 key areas that we've identified as an agency. And then within those 6, we have several different indicators that we're going to measure. So we have, housing stability, food access, community connection, and then within each of those, we have different subcategories that we rank. And so those of you who are familiar with development, or even if you're not and you're maybe working at a current property, there's a lot of aha moments or lessons learned after the fact, right? All projects that are currently operationalized right now, I bet whoever developed them or whoever's running them, whether it's a resource center or a PSH property, could come up with a pretty extensive list of what they wish they had more of, whether it's more meeting space, location of property, more green space. And many of those things can't be incorporated into every project, right? There is a budget, and sometimes developers, even affordable developers, permanent supportive housing, are forced to develop on a certain parcel for various reasons. And really what this toolkit that we've created and have begun to use does is it flags those deficiencies. So if we want to build a family property, maybe a PSH family property or just a family property, and we have a parcel and we've penciled the project and it's going to go through, we got LIHTC, tax credits, and it's looking great, but there's like the nearest park is 2 miles away. It's on a busy street. It's, not on a bus route for school, all of those things that may not kill the project. We still need affordable housing. And if we have the tools and mechanism to build, let's say 150 units of affordable housing for families, we should do that. But in the pre-development stage, we should be aware of those deficiencies. Like, we need to address that then in another way, whether it's by partnering with local agencies, whether it's through design. So if it's green space, how do we incorporate more green space? Amenities for kids to play if there's no park, safety features if it's on a busy road. So all of those things that oftentimes, I'll just say oftentimes get missed, right? Because it's the development is being done by real estate developers, typically not by service providers. And by the time service providers are in the discussion, it's likely too late to, have a lot of those big asks. So this is an example, just, as I mentioned, we have the 6 categories, and then these are 2 subcategories. So one would be under housing stability, walkability, and one would be under education, school access. So we have it's a fairly long scorecard, and these are just 2 examples of how we would score some of these indicators. So walkability, there's a walk score. So who's ever doing the scorecard would go to that site, and then however that property would score, they would score it accordingly. And again, what this does is it just triggers conversation in pre-development, which oftentimes doesn't occur. So it's a formal process for developers, service providers, housing providers to have this conversation early on. So there's room in here where you can, you can write in what the property may need, the project may need if it is scoring low or if there are concerns. So like I mentioned, it could be partners that need to be at the table early on. One example from, our portfolio, Bud Bailey on 39th South and West Temple, great property, tons of kids. And it was, built less than 2 miles from a school. So no busing, the school wasn't required to bus students. We had over 200 kids under 18 and kind of sandwiched between 45th, 39th, State Street, and all schools being across one of those roads. And it was like 1.7 miles to most of the schools. So that's a huge challenge, right? That's a long ways to walk at night or during the day across busy streets. It's a lot of kids doing that on a regular basis. No sidewalks, not well lit, not a super safe area. And it took a lot of effort once the property was built and people were moved in, of conversations, some better than others, to get busing access to that property. And again, that we were able to get it done, but had that occurred in the pre-development stage, I think it may have worked a little bit more seamlessly. So one example there. And then really once, we score all these and then put it into kind of a scorecard, and it's, again, nothing's set in stone. It's something that we can just look at objectively and also have things to note in the pre-development stage. And those who are familiar with development, it's very important to have a lot of these things in the conversation early on, otherwise they get missed. So I don't know if you have anything to add.
Yeah, we got a couple of questions that relate. I'll take a
Cool.
stab at them and then Russell. So I'll go to the second one first. How do we ensure that SDoH are addressed for those in poverty or homelessness when most affordable housing is available in areas that are averse to SDoH effects? So that's exactly why this is a thing. So we have experienced it as an agency. This exists in our community on the east-west side dynamic, and where the price of land cost, that impacts that. So one of these is advocacy. We do need mechanisms, tools, support, policy that helps with equity. So this grabs all the DEI as well, which where do folks live? What are available in our communities? Our communities that need the most support or where attention needs to be. So how is transportation in the areas where transportation is not as great? That's what we should be focusing on. One of the benefits maybe of development and where government is involved and developers are involved is there is a little bit of the hope, I guess, is if done well, and Bud Bailey is an example, hopefully it sparks further growth and development. And so on the kind of the market forces side, do we plant a seed by developing? And the hope is we don't walk away, but we lean in to say, gosh, there's no sidewalks here, we need sidewalks. Transportation needs to be improved. We'd really need a grocery store. And so that's, I think, the force as well, is if we lean in, we both need to kind of make sure there's equity in location where we're citing things. We also need to lean in to say all communities can be uplifted, and our agency as one needs to play an active role in that. So then the one prior, what has helped your agency build connection with systems and providers who specialize in addressing other SDoH for your clients so you can remain focused on housing? A couple of just angles here. So I think what the model suggests is you can't pull them apart. So we have to be in the game in some way. So it doesn't necessarily mean we do it as an agency, but through partnership. A couple real quick examples. A number of years ago, we had a number of residents, 16 in a period of a year of our residents at Grace Mary Manor who passed away for varying medical conditions and other things. That obviously was very difficult, noticed, something we deeply cared about. We leaned in to the medical community, meeting with 4th Street Clinic and other providers to seek funding. And that sparked the establishment of nurse care management. The new funding came in, Intermountain, the Community Foundation. So that's one example of something that came out of, unfortunately, something not great, but really the health disparities of folks who have lived on the street, that we observe that firsthand. And so that's one example of a response. The other element here is, if we think what we see going on in the healthcare system, the kind of remain focused on housing, somewhere like Intermountain is, of course, remain focused on healthcare, but what they've realized is, gosh, if all we focus on is medical intervention, that's only 20%. So the learning here to some degree is we have to be engaged in those other things if we really are trying to make impact. So I think that's probably true on our end as well, as while we're in the housing game, we are engaged in these other things, because if long-term housing is our goal, all these other factors matter. Nutrition, education, employment, community connection. And so partnerships are it. So Russell, if you have any.
Yeah, maybe just to close that on the scorecard. I think it is a community conversation as well. You know, we at Housing Connect have been collaborating with Salt Lake County recently in conversations. They're looking at helping us, but also more broadly, building out data and different layers in ArcGIS to be able to objectively evaluate parcels of land throughout the county in these areas. So I think momentum is here with SDoH in various levels, and I think hopefully in the near future, a lot of that will be trickled down into direct impact for those we serve. But yeah, so maybe that's, we're kind of close on time here. That'll be all on the scorecard. Zach, if you want to this.
Sure. So maybe giving some context, and feel free as we kind of wrap up too to toss questions in. So we want to make sure we use some minutes here at the end to answer some things. So a couple of our staff internally, when we presented some of this, kind of had the like, well, no duh, this is what we've done for years. So I think it's great if that lands, because really what that shows is already as a system, we are operating in this way, that we are minding all the different parts of what go on. So if we're in this work of making homelessness rare, brief, and non-reoccurring, with social determinants, there's kind of two sides of it. So one, kind of what's this health thing? Well, the word health here is broad. It's not just medical health, but wellness and health as both individuals, families, and community. And what we know is we're doing a lot of work on the upfront crisis. We need to make sure we meet the shelter need for folks this year. And we need a whole bunch more housing. But the precursor of this is, well, if we want to go upstream and work towards prevention, how well our community is minding each of these social determinants has an impact on whether individuals land in homelessness. And so I'll get to some of the kind of who's involved. But what are some of the markings here if we look at this, even if we look at the state Utah strategic plan? So number 4 gets at some of these questions. We're collaborative, and there's examples of this across the board. I'm thinking of, for example, the Road Home for some time has said, gosh, we have been active in the game of making sure that shelter resources are available, but we're seeing so much mental health and substance use need, and making sure there's integration there. On the substance use and mental health side, we see that community for some time has worked and said, gosh, and many of the individuals that have had need end up experiencing homelessness. And I think in the last number of years, we've seen this great integration that's only going to get stronger. And we could pick any of these parts. McKinney-Vento, what a great legislation around. There's something around the overlap of the education system and homelessness, and making sure that those systems we're required to, really. So I think that's there. But if we look specifically about these impacts, let's go to the second, so the gaps. So we know this. We know that housing is a critical element, one of the core social determinants. Number two, this could be broad, both on medical as well, but we know that access to healthcare and really it being accessible to and low barrier to folks who maybe have not engaged for various reasons in that system, we need to make sure it's accessible. Number three, as we talked about, the core central role of case management. What a key element. The other nod that I'd love to put here is knowing this very true of our property managers. I see I think one or two in the group with us. They do this all day long as well. So it's not just that your title is case manager. Our housing choice voucher caseworkers equally do case management. And so this really is as a mode of thinking about the many needs of a household. And while our primary role might be something, let's say work as maintenance and I enter some of our units, even that role of seeing the condition of how things are and say, gosh, it looks like that household doesn't have food, and get word to someone who can help them with that. That's all of what that is. And then data, that's the other element here that we haven't touched on too much, but there's an element of which I think coordinated entry comes into, is how are we as a community kind of looking at who has need and how we're matching that need with resources. Go to the next, jump to the next slide. So anchoring it here. So looking at the coalition, we look at the different core function groups again, another nod, and I don't know, there's maybe a chicken and egg to this, but an acknowledgement that, gosh, these look a whole bunch like the social determinants of health, housing, health and wellness, employment, education, community engagement, and the other conditions of that. So I think just a nod here that as we maybe putting on my involvement in this group, here's another reason why this structure makes a whole bunch of sense, why we have those folks at the table.
Zach, we do also have 2 new questions. If you want to, in the last 5 minutes, maybe take a look at those.
Great. Yeah, let's jump to these. So I know many agencies, coalitions are using Unite Us. Does this play into the efforts? So yeah, Russell, do you want to take that one?
Yeah, sure. So I mentioned it earlier. I think many on the call are familiar with Unite Us and involved with it. And we are as well as a housing authority, and we will continue to be. Zach and I were just talking prior to this presentation about that very topic. The model, I think, is exactly what we want as a community. I think the challenge to get there is that it's the model only works if everyone participates on a regular basis and at a high level, right? So until every agency implements Unite Us as standard practice and how they make referrals, I'm not sure it'll be fully functional as a community. We are, as an agency, working to get there and continuing to be in conversations with Unite Us to make sure that we are a participating partner. But for those of you who are not familiar with Unite Us, I would encourage you to either email Zach or I after this, or just do a quick search of Unite Us to get connected as a participating agency. Hope that answered it.
And we have time for one last question. There is one last one, which is, I'll just read it out. Any advice on how to introduce concerns about SDoH impacts into conversations about economic development projects in a way that will be better received by business leaders and other interest groups? It seems like those concerns are getting minimized or seen as secondary in conversations around things like the inland port.
I'll grab the question and our last slide here, hopefully to kind of, so they're all related. And what, as the question I think aptly asks, how do we make sure that most everyone, especially to this slide, the leaders in our community that have maybe more influence than others, hold this in mind? And so maybe grabbing just the element of homelessness. might we as a community encourage that to be seen as a symptom of greater things? And just as with this model, we're saying for an individual, there's many things at play, and what's come before is also, there's a history thing to the social determinant. That's true of our community too. And you know, the number of individuals that need help and need access to housing and adequate incomes to pay for housing, that's the current pulse of how well we're doing as a community. Now, the challenge here is the role of many of us is to find ways to make people care and see that as how it relates to them. And we know some of these elements. If we're buffered from it or we're distant from it, it's harder to feel that. And so, yes, there's certainly the unsavory elements of I'm driving to my job downtown and I see some of these impacts and I just don't like seeing it. That's one way of kind of motivation, but I think what the core of the question is how do we get a deeper care and really for them to care about that's a person over there who needs assistance, that has a history and value and agency of, you know, we don't remove choice in the process of how we engage as a community as well. So tied to this, I think this work is not in isolation. This can't be talked about in a container. And so, but if we look here in terms of the Utah Homelessness Council, one thing that I think is very exciting about it is look at the representation. This is the group that we have and need to make change. So the leadership at each of our state departments, schools, legislative leaders, mayors, the private sector, the public sector. So I think the more that these topics are talked about, and maybe social determinant provides an introduction to say, this overlays with homelessness. The conditions in which our communities are currently sitting matter, and the more we make them healthy globally, that probably ends up solving the state plan, or at least getting there around making homelessness rare, brief, and non-reoccurring.
So we are coming to the end here. The contact information for our speakers is available on the screen now. Thank you. If anybody has any questions or concerns, would y'all be okay if they emailed you?
Yeah, of course.
Wonderful. So thank you everyone so much for joining us today. We will be back with another closeout session at 1:20, and that will be the end of the Utah Homeless Summit. So we hope that you will join us. Thanks so much for joining us for this session. Thank you, Russell and Zach. It was a wonderful presentation.
Thanks, everyone.
Bye, everyone.